Yes, I think it's a binary question to ask whether we're ready or not. I think you can ask how ready are we. I think we are as ready as we can be at the moment. I think we need to lift the area up a bit because there has been a lot of challenges for medical devices in Europe over the last couple of years. We have our share of scandals, so to say. So the area needs to be lifted, and that's why the new regulations has come into place, the MDR and the IVDR. So that's good for patients in Europe. That's also good for the industry. I think the competent authorities have been working on this for the last couple of years, and I think some of them have come a long way. We're not all there yet for all competent authorities, I think, but all in all, it's also a question about the manufacturers in Europe, because a lot of responsibility is put on manufacturers to comply with these regulations, and it is a challenge to get your CE marking in place to be able to live up to the new regulations. And that's actually a little bit of an obligation that's put on the manufacturers to do so. So in that sense, it's only a market regulation, market surveillance system in many ways. And so the responsibility is to a large extent put on manufacturers. I don't want to estimate anything on percentages here. I think that's quite difficult. But of course, there will be some manufacturers who will not be able to live up to the new regulations. And I think that's a calculated risk for the politicians when they decided this. As I said, the bar needed to be lifted, and not everybody will be able to live up to the new regulations. So not everything should come into the new regulatory system. I'm not going to deny that, but I think in many ways, I think we are all doing their best to comply with the new regulations. Competent authorities, but I also think manufacturers are. I think notified bodies, which are a big part in this, also are doing their best to step up to this. But I think there's a large expectation that the market here should adjust itself in many ways. And I think we are still a little bit seeing the adjustments are happening as we're speaking. And I think that's of course a challenge, and we need all to do our best to make that work in as smooth as possible way for all of us. Still bearing in mind that we need to lift patient safety in this area.